Depression, the most common psychiatric disorder in the world. A word that people have different perceptions about it and use it in different situations. But scientifically, depressive disorders are defined by criteria. So the diagnosis should be made based on the complete clinical history and examination. The individuals must be experiencing at least 5 symptoms of following criteria for at least 2 weeks. And one of the symptoms should be either depressed mood or loss of interest. The criteria include depressed mood for most of the daytime almost every day. The second one is diminished interest in all or almost all of the daily activities nearly every day. The third one is loss of energy or fatigue nearly every day. The next one is significant weight loss or weight gain. For example, 5% of total weight within a month without any dieting. And either we can count this criterion when there is obvious increase or decrease in appetite. Reduction of physical activity that is obvious for others or slowing down of thought. Decreased concentration or decreased ability to think. Feeling of excessive guilt with no specific reasons or feeling worthlessness. And finally, recurrent suicidal thoughts or feeling of early death. Keep in mind that these symptoms must significantly impair the occupational or social functioning, and it is necessary to find out that these symptoms are not due to substance abuse or any medical conditions else. If an individual experiences 5 or more of these criteria, with at least one of the 2 first criteria, the diagnosis is major depressive disorder or MDD. But minor depressive disorder consists of depressed mood plus 1 to 3 of other criteria. Sometimes it is necessary to order laboratory tests to rule out other medical conditions because some of diseases can cause psychiatric symptoms like anemia, vitamin D deficiency, hypothyroidism, and low blood pressure. Sometimes depression occurs with physical issues and cause people to express their emotional illness as a result of their physical problems that can make the diagnosis more difficult. Here are some of physical symptoms of depression. The most common physical issue in depressed people is unexplained aches and pain because the 2 important neurotransmitters called serotonin and norepinephrine that regulate our mood are directly related to our perception of pain. Digestive disorder is another common issue of depression. Our gastrointestinal system is full of serotonin receptors. When we are worried, scared, or sad, we feel sick in our stomach. That's why depressed people sometimes experience indigestion, nausea, cramps, diarrhea, or constipation. Change in sleep pattern may happen in individuals. They might stay up all the night and feel worried or sad about everything and anyone. Or they may find that sleep is the best way to escape those thoughts and they can get relief, so they sleep too much.